Okay, sa meridian theory na tayo, part 9, yung large intestine channel of hand brachium. So dito yung illustration po ng large intestine meridian of the hand brachium. Ang large intestine nag-start po dito sa may dulo ng index finger, paakyat, tapos pumunta po dito sa may do14 sa likod, and pabalik po yung isa papunta pababa sa stomach 37, and yung isa naman from LI15 paakyat po dito sa may LI20 sa nose. The meridian begins at LI1 at the radial side of the index finger. Yung radial side po, yung side ng thumb. But in the energy flow between the meridians in the superficial energy circulation, the energy flows out of the lung meridian to large intestine at an earlier point. The energy flows out of the lung 7, also called exit point, into point LI4, also called entry point. So from lung 7, pumupunta po ng LI4. The meridian flows of the lateral side of arm to the elbow and shoulder along the anterior border of the acromion to the front of the neck between the two heads of the sternocleidomastoid muscle. Dito po sa may neck to the face. It crosses the midline of the face over the lips and ends at the opposite side of the face at the side of the nose. So, kung halimbawa sa right hand, magko-cross po siya ng opposite side ng face, ang large intestine mag-i-end dito sa opposite side ng nose. The inner branches from the acromion to the 7th cervical vertebra, yung sabi ko po, pumunta sa likod, 2.214, where all young meridians meet. So, sumama din po sa do14. Ito po yung another branch, enter the supraclavicular fossa to the interior and flows into the lungs coupled organ and farther downward into the large intestines. So, ito po yung picture, yung flow. Sundan lang po ninyo yung mga points hanggang mag-end po dito sa LI20. The location ng LI1 on the index finger, dito po sa picture, kung titingnan nyo po, 0.1 tune from the radial corner of the nail. Ang point explanation niya, the first point of the meridian, it is also the metal point, which is the house element of the organ. As such, the point can be tonified or sedated selectively in order to increase or decrease the yang energy. It is used sparingly because of its painful location, so hindi siya madalas ginagamit dahil masakit at the corner of the fingernail. Nevertheless, it is a good pain relieving point in itself, especially for toothache. So ginagamit po sa toothache. LI2 naman, yung location, dito po sa picture, sa may index finger pa rin, on the radial aspect of the index finger, distal to the metacarpal joint, at the junction of the shaft and the bases of the proximal phalanx. So malapit po dito sa my joint. Yung point explanation, this is used sa sedation point and water point of the meridian. Applying sedation needle technique on the point not only disperses large intestine yang, but also sedates lung yang indirectly, as they are coupled organs with an interior connection between them. So, tingnan po natin yung location ng LI1. Okay po. Sa LI4 naman, dito yung picture niya. Nasa may gitna po siya ng itong index finger na bone. On the radial aspect of the hand between the first and second metacarpal bones, close to the second metacarpal bone and approximately at its midpoint. Yung point explanation, ito po yung U1 source point. Area distal point for head and face, and meridian distal point. It is one of the most commonly used point in acupuncture. It is excellent in the treatment of any problem of the head, face, and in general pain condition. So maganda po siya sa mga problem or issues na kakaroon sa head and face and sa mga pain condition. This point is also referred to as the great eliminator. It's very useful when treating constipation, but can also be used to treat other elimination problems such as difficult urination, difficulty in showing emotions, painful menstruations, and even in childbirth to assist in opening the cervix. So pwede natin ma-advise yung mga nagbubuntis kung gusto nila mabilis yung panganganak. Ito po yung pressure point na pwede nilang diinan while nag-labor. However, care should be taken not to use the point if your patient is pregnant or has diarrhea or excessive sweating already. This may worsen their symptoms or cause miscarriage. So magagamit po natin siya sa panganganak, pero during sa pagbubuntis, hindi po siya dapat gamitin. LI4 is the entry point of the meridian, meaning the energy from the preceding lung meridian flows in at this point and not through LI1 in the superficial energy circulation. So entry point po siya ng meridian, yung LI4.